Good afternoon, team. My name is Juan Manuel Aguirre, and I'm going to discuss the topic of telemedicine. So, the first question that everyone has, what is telemedicine? So, telemedicine refers to the practice of caring for patients remotely when the provider and the patients are not physically present, basically on the same location. Um, Physicians and patients can share information in real time from one computer screen to another. Even they can see and capture basically the medical records from different locations. Um, what basically the telemedicine is using a software where the patients and the doctors can be connected. So we have three different types of telemedicine. So the first one is interactive medicine. So basically, this one is named as live telemedicine, which allows patients and physicians to communicate in real time. I think this is the preferable one for everyone. The second one is store and forward. Basically, this one the providers shared information about from the patients to a different practitioners in different locations. Basically, they are using this to do consultations at distance. And the last one is remote monitoring. This one is mainly used by the providers when they want to track, for example, the blood pressure, the blood sugar from the patients. So this is how they are using this type of telemedicine. So let's go back a little bit about the history of the telemedicine. So contrary to what basically the people is thinking, so telemedicine is not a new practice. So as we can see, the telemedicine started in the 19th century. Um, it is being documented that casualties and injuries were reported using the telegraph during the Civil War, and even they were ordering medical supplies. So if we think about this is the beginning of the telemedicine. Um, During the 20th century, the first diagnostic was sent via telephone between two medical staff in two different locations. Um, and they were 24 miles apart from each other. Then in 1959, physicians from the University of Nebraska, they transmitted neurological examination across campus to medical students using a two-way interactive televisions. But how is telemedicine today? So now you know that everyone is having access to basic telemedicine devices like mobile devices and computers. So, and this is helping a lot in the rural areas where people is not having access to a doctors. So now, what are the benefits for the telemedicine? So the first one is to the providers. So the providers and physicians and the nurses, they are using technology more efficiently. So they are using basically the software to source the medical records, to diagnose the basically the patients, um, and also they can treat patients on real time. But there is one more benefit from them, so which is basically they have an increase in revenue because by utilizing telemedicine, physicians can see more patients without basically hiring more people and also not getting a more office space, which this is great for them. The second one is the benefits to the patients. So there is a lot from here. So the first one is we have the transportation issue, right? So patients can avoid spending gas, money, or wasting time in traffic if they are doing video consultations. Another big benefit is basically no missing work. So if they can arrange appointments online or by video, so they can do this during the break or after the work hours. And the last benefit is for who's paying the basically a treatment. So, and in this case is insurance companies. It is documented that, for example, Aetna, they are getting benefit from this because the cost for the treatment is cheaper, and this is a very good for everyone. Oh, but in the other side, we have the disadvantages of the telemedicine. The first one is that we don't have clear policies, right? So this is one industry that is being growing so fast, and basically we don't have the entire laws to control the industry. For example, in the United States, so only 33 states have a telemedicine parity laws, which basically this allows to the doctors to get reimbursed, like if this is in like an in-person visit. The second disadvantage is there are fewer face-to-face consultations. So and this is mainly for older adults where they feel more comfortable with the office visit instead of using the technology. And in some cases, doctors can feel that there is not engagement. And one of the most important things on this is because there is a potential of error, as technology cannot always capture what the human can basically see. And the last one, and it is really important, is that technology is expensive. So implementing a new system requires training, and sometimes staff members find it difficult to welcome to this change. So now, if we talk about the applications, so as we are mentioning, thanks to the telemedicine, we have a better opportunity to connect with the patients everywhere, right? So, but there are some ways that we can use the telemedicine. For example, the chronic disease management. Here, the physicians are using these technology to monitoring the blood pressure, the glucose levels, and basically they are transmitting data from one device to another. The second one could be the medication management. So in this case, the healthcare providers are monitoring when the patients are taking their medicine, and this is helping a lot to them because they can avoid readmitting to the hospitals. The next one, not less important, is sharing medical information. Basically, this is helping the physicians or the healthcare providers to share information with different healthcare systems. So, and basically, this is helping them to get diagnostics like images, blood analysis, and they can basically have an assessment to the patients in real time. Oh, and I think the next one is the emergency room. It is to me is the most important, because with the telemedicine we can avoid having a lot of people in the emergency rooms. So what they are trying to do is basically they can have a video chats with patients, and the doctor can determine if they really need to go to the emergency room. And the last one that I'm going to discuss here is basically the second opinion. Today, there are a lot of telemedicine solutions that allows patients to seek for a second opinion when they are at home. So you don't need to go out. You just need to talk to somebody else and provide basically your record, and they will tell you, hey, that's true or not. So, but now let's talk about the laws governing telemedicine practice. So the first question that everyone is having is, what regulations do we have in place? So this is not fully regulated. As we mentioned before, not all the states have the same laws, and this is a disadvantage. Now, for example, how will physicians be reimbursed? Um, Also, there are not all the states have parity lines laws, basically, and this is not allowing the doctors to charge as this is a on-site visit. So the next question is, can physicians practice in multiple states? Yes, they can do, but they need to get the license from every state, which in some cases it is expensive for the doctors. And the most important is basically, do the patients have to provide informed consent prior to using telehealth service? The answer is yes. If they don't get the consent from the patients, the healthcare facilities are not getting reimbursed. So this is really important from them. Now let's talk about what are the barriers of the telemedicine. So as this is a new trend of how the doctors are treating patients, the first one is basically getting reimbursed. For example, if private payers, let's say Medicaid or Medicare, choose not to pay the reimbursement, so then the fees are following into the hospitals. And if that happens, basically the hospital stops doing the telemedicine. As we mentioned previously, the physician licensing, this is expensive, and not every doctor has been approved to provide service in different states. And the last one is security concerns. There is a lot of concerns about how the doctors are basically managing their data. And also, you can imagine, so when you're having a video or chat with the doctors, sometimes these communications are not safe, and somebody can basically go into your or get your record. The last one is, what is the future of telemedicine? There is a lot. So for example, if you think about this, think about having like an online medical service 24 hours. So where you can call and get answers all the time. The second one is basically telemedicine across the border. So let's say that now you are in Mexico and you want to get a consultation from a US doctor. So you can do it. But the problem, we are going back to the licenses, but it should be laws that define this. The next one could be acceptability. So I think people is getting into. So people want it because you cannot wait. You are gaining a lot by not basically being in traffic and also not missing appointments or rescheduling really easy and having a video chat with the doctors. The next one is the health system collaboration. So by doing this, we can have different research hospitals to share information about, hey, we are seeing this problem, have you seen this problem, and how you treat it. So it is a good collaboration, and we can have an improvement in the patients. And the last one is basically augmented reality mirrors. So basically, we already have the technology, right? But we need to improve it. So let's say that now they can treat eyes problems. Basically, if you can have your phone in your face, and the doctor can say, "Oh yeah, you have this," or maybe by looking a picture of your skin, so they can see if you have any problem that you need to be treated. So I think this is really important. So if we talk about the market side of the telemedicine, So right now, the market size is 7 billions. So it's a lot of money, and it's basically expected that they grow 22% until the 2028. So we are forecasting a revenue for around 300 billions. So this is going to be huge, and it is going to be one of the biggest industries in the world. So that's it. This is my presentation. Please let me know if you have any question. Thank you so much.